The COVID-19 case count stood at 250 at the beginning of July, and the delay in phase 2 of the reopening of the airports was announced as a precautionary measure geared at mitigating the spread of COVID-19 locally and preventing the possibilities of imported cases. But concurrently, the country moved into the second phase of economic reopening, which has since seen a steep rise in positive cases. On Monday, Guyana had reached its 300 mark of cases from mostly local transmission, especially in the hinterland regions. During phase 1 of the country's reopening, which began on June 18, in excess of 64 new cases were recorded. During the second phase, which began on July 3, more than 50 positive cases have been registered, increasing the number of active cases to 128. However, according to health officials, balancing the reopening of the economy with simultaneously controlling COVID-19 presents a tricky dilemma. Deputy Chief Medical Officer Dr. Karen Gordon-Boyle, during a recent telephone interview, was questioned whether following through the economy's phased reopening plans was ideal amid the worsening COVID-19 situation. She pointed out that in spite of a possibility of an upsurge in cases as a result of lessening restrictions, there was no way the country can remain on lockdown indefinitely.
If we continue with the country staying locked down, closed down, and everything closed, then jobs are going to disappear, money is going to stop circulating, increase, and we're going to have a lot of other issues on our hands. So you need to be able to keep businesses, which are like the heartbeat of your country, alive. You have to look at the private sector and their needs as well. You can't expect them to continue paying people's salary and people aren't working, or the businesses are not making money.
Dr. Gordon-Boyle noted that ideally 1 or 2 months of strict public health intervention coupled with effective enforcement measures should be enough to prompt authorities to limit restrictions.
But when it's not done forcefully and effectively, it means you have to do it for a longer period of time to get the kind of effects that you might be looking for. It will never be quite as well done, but then the challenge is, what are you doing to businesses? What are you doing to the ability of the country to generate funds to keep the machinery going?
The Deputy Chief Medical Officer reminded that the 6th-phase reopening plan, which is scheduled to conclude on August 28, is not written in stone. She also assured that the ministry is closely monitoring the COVID-19 situation.
We can plan all we want, but we have to look at what the data says at the time, and based on that, we make a decision. So in other words, we can say we're going to do it July 4th or July 5th or whatever. The end of the month, we're going to do X. But if we see the epidemic moving in a certain direction, then that plan has to be modified to suit.
There have been a significant spike in positive cases and deaths in a number of countries around the world, including the United States of America, where economies have reopened too early, prompting many areas to back off from phased reopening plans. Temika Rodney reporting for the HGP Nightly News.